Ladies and gentlemen, this woman got a Botox surgery done. Now, not only is her one eye smaller than the other, she can't see out of that one eye now. I don't know why y'all get so many alterations done to yourself. I guess you just don't want to, embrace the fact that you just age faster than everybody else. Just deal with it. Wow, is it really this deep? I guess apparently it is. So, this woman has shared images of herself after a botched Botox, which she was unable to see out of one eye. And she is attempting to warn others about getting Botox at their local spa and not from a doctor. So, she got injections. At a spa. She did not like her saggy eyes, and one eye was, I guess, sagging a little more than the other. So she decided to get Botox done, and it has done tremendous damage. So, how did her eye get like that? She had an episode of mini strokes, and over period of time, the one eye on her face started sagging. Okay, well, I mean, I can understand where she might want to do something, but sometimes a lot of these things are just way too extreme, and you already in a medical sensitive position, and now you're trying to alter yourself. So she decided to get a Botox to reduce the sagging. And having received Botox before from other clinics, she traveled to a spa in Canton, Georgia, and this was in May, on the recommendation of a nurse practitioner that she then received an injection from. So she got Botox from this nurse practitioner. So it was a prescription treatment that is injected into the muscle between the brow and the forehead. I guess whatever lines you have there. And it provides a temporary modification to frown lines. It's a single 15-minute treatment that lasts between 3 to 6 months. She shared her pictures on Facebook, warning others about the risk of getting Botox at local spas and when there's no medical doctor present. Businesswoman wrote, if you're considering any injection, specifically an eyebrow lift, do your research before you go anywhere new. My quality of life is diminished to where I can't work, and I was a nervous wreck driving because she couldn't see out of her left eye. Wow. This is not my first time getting injections, but is the first time at this location. I had the procedure done along with a small amount of Botox near my eyebrows to lift my very hooded eyelids. Exactly 1 week later, I noticed I was having trouble with my vision in my left eye. I understand there is a 5% chance that Botox can leak or migrate into the eyelid, causing it to droop. Sherry notified the clinic, returning for a follow up assessment to try to fix the damage. Following an examination, the clinician decided to inject more Botox into her temple. Right, and it got worse. It got worse. Mm, mm, mm. And so she had the first injection in the beginning of May, the second one on May 23rd. In the US, the laws regarding who can administer Botox vary from state to state. The clinic suggested the use of Botox to rectify the mistake made in lifting the brow. To her knowledge, there was no doctor present on site, at the time or involved in the procedure at any point. After the assessment, she decided a small amount of Botox in the temple would relax the area and force the brow muscles to work harder and start to lift the lid, Sherry said. She injected more above the brow to try and compensate and open the eye back up. As it was told, it showed the beginning to open it back up. And she was told after the injection was done, it would open back up in 3 to 5 days. Mm-mm-mm. I did receive a partial refund for being overcharged. However, the amount of the time I lost, I was unable to work, and the inability to drive pales in comparison. On May 28th, Sherry visited a doctor and underwent an eye examination. The doctor gave her prescription for a 30-day supply he gave her some Upneek eye drops, which was sent via the mail. However, due to the late delivery, the drops took over a week to arrive. The drops initially helped improve the drooping eye, however, only lasted for 6 hours before wearing off. Her eyelid would become so heavy that afternoon she would have to use steri strips to be able to see out of her left eye. After a week on the the spa no longer responded to her emails. I chose to see a medical doctor to have him examine the incision of the thread lift to be certain that they were healing properly. Another out of pocket expense I should not have to incur, she said. This new doctor did prescribe, gave her another medication on the 25th of June, and it has improved it some. Mm, mm, mm. So she said she is still recovering, but it's very slow. However, she, is on the mend, but the whole process is slow. So more than likely it's going to take her up to 6 months for the injections that she got to wear off. Mm, mm, mm. Why you do it? Why do you do this? Why? I've seen so many of these things botched. It's not even funny. But hey, I guess it's your money and your face. Mm, mm, mm. Please leave your comment and subscribe. Don't forget to hit on the notification bell, and I'll see you on the next video. Peace, family.